in the community, there are those old age people who needs help. So I do the screening of BP and the sugar diabetes. We're given the machines by the International Health Organization, which we use for the community. So the people are happy. And the community also, if they have any problems in their community, they know that there is Mary, who is a community health worker. They come to me, then they told me the problems, then I do the referring also to clinic or for hospitals for further management.
I used to get scared of some medic information. They could just say, oh, your blood pressure is high, it is just 130 over maybe 80 or 70 something, and they could scare you. But now it's not easy to scare me because I have knowledge and I know when to go to the hospital, when to take medicine, when to rest, when to maybe take water, when to solve my problems. So some situations do not scare me and I know what to do.
I also teach my community about this cholera pandemic. At the moment, there's this cholera pandemic which has arisen within the community. So I teach them how to handle and to store water. I teach them that water should be stored in clean buckets with the lids so that the water don't become contaminated.
So I pick interest in getting to know the story. So I tried to ask her details about when did she discover that she was diabetic, and told me about 6 months ago. So there I was with a victim before me, and I was happy to now embark on giving advice. So I kept asking questions here and there. But then what was good for me is that I had just gotten that information from the classroom in the training, and I chose to transfer it to this friend of mine so he could share with the patient. And this friend of mine was looking at me all stunned when I explained all these things after learning what we learned yesterday. And then he goes like, wow, are you a doctor? And I'm like, no, I'm not a doctor. I'm simply trying to give you information that I've gotten just from the training that we have had. And this is what we are out to do in our community, to help people to get to understand that illnesses are out here, but if we take care of ourselves, we can actually mitigate or prevent them. So I emphasized cutting down the sugar, eating in portions, drinking a lot of water, and then I also advised about how to wear the nice shoes to avoid hurting herself, to avoid injuries. All these I mentioned, and my friend was so amazed seeing the help. And he promised from yesterday, he's going to speak to the friend and advise. And I also promised, if need be, let them invite me so I can speak to the patient more often and more much. So I was so happy. I spent almost 40 minutes talking about that, and that's why my friend was so amazed as to why I got that kind of knowledge